I initially started my training up in Cleveland, Ohio, where I did my internal medicine program. And during that time, I had a keen interest in cardiology, which led me to a program down in Miami Beach, Mount Sinai Medical Center. And I spent a few years training with interventional cardiology. And what that is the study of arteries, opening up closed vessels, as well as becoming an interventional cardiologist. I studied electrophysiology, which is the study of the electrical system of the heart. So from that point on, and after maybe about 25 years in practice, we kind of shifted our methodology from the invasive practice now to a clinical-based practice, predominantly with prevention. And I think that's really where we stand today, trying to instill good health to our patients. Prevention is keeping the patients out of the hospital. Prevention is keeping the patients out of the cemeteries. Donna is my wife. We've been working together for about 25 years now. She's an advanced registered nurse practitioner, and she's really been my right-hand woman for a long time.
My scope of our practice is wellness and promoting good health, and we have used MonaVie as our main tool in our practice. We've been extremely successful, and the outcomes of our patients, whether they have lost weight or just a great well-being, we've introduced this in our home. We've introduced this into our family. MonaVie has been a key point of our life. I can't say enough about all the products because it's a win-win for us.
I'm very skeptical. You can't get me to buy something without knowledge. And I can't bring this product to my patients unless I did the research. And I spent about, I say, 30 days of reading. I researched everything, and I didn't realize how much science was behind MonaVie. I mean, I had articles probably 2 inches thick. That's what grasped me. There's too many companies out there that are fly-by-night companies. Their interests are just to sell products. I needed something that I could teach my patients that are credible, something of validity, something that has grown within us to share that product. We're all in. We are all in on this product, and I can tell you what, our patients, once they try this, and I'll tell you what I do all day long. I have a little cup. I'm pouring juice all day long to my patients, right?
Yep.
Donna's got the blender going with the RVL. We have the chocolate, the vanilla. It's unbelievable.
And our need was different. We did not have a financial need to get involved in MonaVie. We got into MonaVie because we promote wellness in our practice, and we needed a tool to be able to achieve our goal, and that's why we got into MonaVie.
It's a balance. We got to figure out, we have to give a patient a medicine because they need it. We have to practice the science. We've got to be scientific as physicians. We still have to practice conventional medicine. But when you have something that's so packed with nutrients, it's a shame if doctors don't jump on board. They got to run for this. This has, in a way, taken us to the patient directly. Our patients are no longer the patient and the doctor. The camaraderie now. These patients are in my living room. We're doing tasting parties at their house. This has developed us a bond with our patients that we've never had before. How do you stay well? Diet, exercise. We introduced the MonaVie product to everybody. And I find that there's a big reward now. Personally, I think my whole practice, I think our practice has changed because the sentiment is so different, making people well again and not being in a sick business, but being in a wellness business. That's really changed our lives. And I think what we're doing now is changing lives of others. And that's through allowing us and being privileged to be part of the MonaVie family. I am Dr. Andre Hurwitz, and I am MonaVie.
And I'm Donna Hurwitz, and I am MonaVie.